In 2003, we had gone down to Lake Powell, and Jim really knew that there was something different going on. He actually felt like he was dying. We got back from Lake Powell and went into the doctor the next morning and took his blood and knew right away. And so that the next morning, we're down in Utah Valley and starting chemo. So after we got out of there, we ended up in LDS hospital to try the bone marrow, 2 bone marrow transplants. And yeah, he didn't make it, but it gave us a lot of time. So we had that. Yeah, LDS hospital was great, and that the nurses, the doctors, they're all very personable, they're very caring.
I can only say that I was incredibly lucky to be sent to LDS and to Dr. Peterson's program. They helped me through everything, all the questions. They all came in, they discussed my options, told me what was wrong, what I had, what type of leukemia. Everything was incredible.
She's my best friend, and that whole illness was terribly tough on all of us.
Many of us in the program have been involved in both treating leukemia patients and transplant patients for decades. And so combined, we have an enormous aggregate experience. Technologies have been developed that enable us to safely do stem cell transplantation in patients up to age 75, 80, and where new technologies that we have been in the forefront with have made it so 95% of patients, if not more, who needs a transplant will have a safe and suitable donor to do that.
It's an incredible feeling to have someone think enough about that program and watching me go through it that they would want to donate to that program.
When we walk in that door and see her name, will be a great feeling for Jay and I to know that maybe we helped a little bit.
We are one of the 2 centers who are the only place basically in the Intermountain area that can treat any acute leukemia patients in a very timely fashion with the individual treatment each patient requires. So it means that as patients are referred to our program, they will be able not only to get the best care that we can provide, but get it in an environment that is healing and that is facilitating patients overcoming the life-changing event it is to have a diagnosis of cancer in general and certainly acute leukemia specifically.
LDS hospital, you know, I identify with people that are there, that are going through the similar experiences. I know a lot that have made it through the bone marrow process and that are living healthy, productive lives. And so to help make that experience better, you know, by improving the clinic, by helping in any way. It's like, there's my passion, is to help others that are going through the same thing that we went through. And I know that Jim, you know, we built this business. This is the fruit of our labors, and so he would want that to happen, to have that be a legacy for him.